Hi, everyone. I'm Dr. Cynthia Anderson. I'm a naturopathic doctor. I am also a nurse midwife, and I teach full time at the University of Bridgeport, where we have a naturopathic clinic that any of you can make appointments at. So, today, thank you for joining. I am talking about premenstrual syndrome, PMS, as it's oftentimes called. And another name for it is premenstrual tension, as tension is often involved with this. So it's a very common condition for many women. About 80% of women do experience premenstrual changes. And about 30 to 40% of women actually state that they have difficulty during this time of the month, and there's a very small percentage that have significant issues that interfere quite dramatically with their life, where they're unable to function. So what is important, and that's about 2.5 to 5% of women, what is important to note is the timing to actually identify whether or not you have PMS. So the timing has to be at the second half of your cycle. So if you're looking at your menstrual cycle, it does not occur from at least oftentimes it is gone once your bleeding starts or once your bleeding ends. And then you don't have it for those 2 weeks. And then around the time you ovulate, which is 14 days into your cycle, you may start getting symptoms, or it might be just the week before you get your period that you start noticing symptoms. Those last 2 weeks. And then once you bleed or start bleeding, once you begin your menses, oftentimes these symptoms might resolve right away, right when bleeding happens, or a couple days or so into bleeding. So there's a lot of symptoms associated, up to 150. And I'm not going to list those all, that'll take way too long. But the most common ones are irritability, anxiety, agitation, anger can be there. Oftentimes people cannot sleep. They have very difficulty concentrating during this time. They might become fatigued. And sometimes connected with this is also fluid retention, this weight gain, maybe a few pounds, 3-4 pounds, and breast tenderness. Those are the main symptoms out of the 150. Again, it's when do these occur and do they resolve? I do want to point out there is the severe symptoms that cause disruption of life. Is called premenstrual dysphoric disorder, and this can be quite dangerous, where somebody might become, so depressed, even suicidal. And to be categorized as this, you have to have 5 of 11 signs and symptoms, with at least one being in the first 4. Let me see if I can share that with you. Okay. So if we look, okay, a PMDD, it has to be at least 5 of these and at least 1 of the 11 in the first 4. So depressed mood, significant anxiety, sudden mood changes, and anger, irritability, or increased conflict with others. And that would need to be diagnosed by a physician or a midwife. Okay. All right. So why do we get PMS? Why do some people get it and other people don't? There's a wide interaction of factors, and it's not completely understood, but the primary cause is excess estrogen or an estrogen progesterone imbalance in the body or a deficiency in progesterone with the elevation in estrogen. Sometimes you have other hormones that are come into play. You might get elevated prolactin. You could have, oftentimes what coexists with this is hypothyroidism, as well as your adrenals could be playing into all of this. And then stress and depression, whether what comes first. Trauma has even been implicated in PMS. For example, if there's sexual abuse in your history, you are more likely to have PMS, be diagnosed with PMS. And nutritional abnormalities figure huge, and diet plays into PMS significantly, and we'll be discussing that a little bit more. So one of the nutrients that comes into play, and actually excess estrogen plays into this. It can actually interfere with our B6 vitamin action. Excess estrogen can do that. And as well as change many of our other hormones. So when we have depleted B6 and many vitamins are considered help with our enzymes in our body, help us metabolize our enzymes. And so B6 is one of those, and B6, when it's depleted, can contribute to many of the signs and symptoms of PMS. So that is just one of the understanding factors of what is going on with PMS. Oftentimes, so again, the excess estrogen is involved. So people who are obese or overweight, you make your estrogen actually from your ovaries, and some in the adrenals, and also in the adipose tissue or fat in your body. So more fat cells, more adipose tissue can increase the estrogen in your body. So then you may have even more estrogen contributing to the PMS. Studies have looked at dietary factors, and in fact, the standard American diet, or as naturopathic doctors, we like to call that SAD, the SAD diet, that can contribute with dairy, with fat and dairy figuring quite largely into play with increasing PMS, as well as sugar, as well as complex carbs. And what is also found is that inflammation is increased in PMS. We can actually measure something called C-reactive protein, or CRP, and that will be higher. And that could be related to your diet. If you change your diet to a less inflammatory one, PMS signs and symptoms might resolve. So again, there is many different hormones involved and many underlying causes. However, I'm going to focus on the excess estrogen because 70% of people who have PMS have excess estrogen. And again, that's characterized by a higher estrogen with lower progesterone, usually that anxiety, irritability, mood swings, nervous tension. So where does this estrogen come from? Well, we talked about endogenously. Some people make more estrogen. They have an imbalance, so they have increased estrogen. And then people can also get it from all kinds of things in the environment. In fact, for example, some meats, chicken, cows, are fed hormones, and those hormones can actually affect our body. And For example, different things like sunscreens can have actually estrogen producing, they're called xenoestrogens. They can act like estrogen in our body, and they actually attach to the estrogen receptors, increasing our risk for PMS, as well as things like cancer. So, so this estrogen dominance can come from the environment as well. In fact, plastics is one of the xenoestrogens that you may have heard about, and you may have heard about BPA. So BPA is a substance that can increase or mimic estrogen in our body, cause an imbalance in our body. And so you will have likely, or now you will see it, is actually BPA-free products. So you might see that in your plastic glasses, and you might see that, for example, in this can. If I show it to you, this is organic, but it's also, can you see that? Non-BPA lining. Okay, so you will note that that is in some cans now to protect us from that excess estrogen. Okay, tampons can even have xenoestrogens in them, and that's been an improvement over the years. But getting all organic tampons can help. So how do we diagnose PMS as a doctor? I will have you keep track using a simple diary, keeping track of your symptoms. When are they happening? What symptoms are they? And if they are the symptoms that relate to PMS, when you come in to be evaluated and they are occurring during that second half of the cycle, then you can be diagnosed with PMS. Besides this, we may do hormone testing. We may, I would always like to check the thyroid, your thyroid hormones, how are they functioning? And adrenal testing is so important, as well as looking at some things like your prolactin levels. So how are we going to prevent PMS? How are we going to treat it? I always think that looking at your diet is the very first thing to look at. It's a simple way to fix things. Well, maybe not so simple. Okay, it involves changes. But once you make these changes and see how good you feel, hopefully you can stick to it. Not all the time. Okay, but just and even simple changes in your diet can have huge effects. Okay, so trying to do more whole foods instead of packaged foods, instead of just combinations of foods that are in packaged foods, eating whole foods. Minimal sugar, minimizing that, cutting down on your carb intake, cutting down on dairy, caffeine, saturated fats like meats have all been implicated. It's so important to add fiber to your diet, and we'll discuss that a little bit further. Things like vegetables, fruit, nuts, seeds can help. And then adding more essential fatty acids, like the good fatty acids, such as fish oil, fish. And again, that would be nuts and seeds. And then working on stress can be very helpful, as well as aerobic exercise. And yoga can be very helpful. So how did this work, changing your diet? So in fact, fruits and veggies contain a lot of fiber, mineral, and vitamins that support estrogen metabolism. They can block attachment to your estrogen receptors in your body, and they can help improve your gut health. And your gut health is so critical, so important when we're talking about estrogen. So vegetarian women who are primarily vegetarian, excrete 2 to 3 times more estrogen than people who do eat meat. and they have 50% less estrogen when it's measured in the blood. And this is because there's less fat, usually in people who are vegetarian in their diet, and there is way more fiber. Cruciferous vegetables, those are things like broccoli, broccoli, there's a whole list of them: bok choy, arugula, Brussels sprouts, cauliflower, collard greens, can all help to metabolize estrogen in proper ways, and help you with your estrogen. So for treatment, besides food, I like to try B6. Now, I never just give B6 alone. I always give it with a B complex, because I think it definitely works better. And oftentimes B6 will work better if it's with vitamin B1 or other vitamins. And so I will get a B complex. And you do want to be careful with B6. You don't want to go too high. You don't want to go above 100 milligrams a day unless you are being in all your B6, unless you're being prescribed it by somebody. And if you do take B6, you do want to know, because in very rare side effect, but too much B6 can actually cause paresthesias, which could be irreversible, like numbing and tingling in various parts of your body. But actually, you can take B6 to help with this. So you just want to not go for, unless you're treated, don't go above 100 milligrams. And you can even take that just only during the second half of your cycle. So that is one thing that's very important. And active forms of both folate and active forms of B6 can be very helpful. Some people cannot break down that B6 very well, depending upon if they have other deficiencies. And so that active form, you can't really see it on here, but it is pyroxyl phosphate. So if you look at B6, and you can go into, any whole, like go into a Whole Foods or a GNC and ask them for the active form of B6. Again, I'll say the name here. It is pyroxyl 5-phosphate. Okay. Magnesium is so helpful. Many people, about half our population, are deficient in magnesium, and women with PMS who have been shown to be low, who have PMS, they might present with migraines, anxiety, depression, and B6 and magnesium can work well together. Just note the side effect of too much magnesium is loose stool. I always recommend somebody start at 200 or 250 milligrams and see how they do, and back off if you get cramping or loose stool. So that is a very good supplement that you may want to try. And then fiber, we'll go into that. In fact, let's see. Yes, I'm actually going to bring us, well, I won't bring us over to our cooking yet, but fiber, in 2016, there was a study that 65% of our estrogen in our bowel can be reabsorbed. It can become unconjugated because of what's going on in our bowel. And then it can be reabsorbed, and it can contribute to PMS and estrogen dominance. So the more fiber you have, so that you don't have constipation, that you are changing the microbes to positive in your gut, can help with metabolizing that estrogen. So one of the things that I like to do is recommend for people is flaxseed. Flaxseed actually has lignans in it that actually can be considered something called phytoestrogens. And these are plant nutrients that can work similar to estrogen and kind of hop on the estrogen receptors and help modulate those. So helping decrease the estrogen activity in your body, and also increase it depending upon your hormone status. Now, it works very well. It can help prevent cancer, but if you actually have cancer at that time, it might not be recommended to utilize flax seeds. Let's see what else. Exercise, very key. Studies have shown that there's less severe and fewer symptoms of PMS in those who exercise regularly. One study found people who did 60 minutes of aerobic exercise for 8 weeks, 3 times a week, who had PMS, felt much improvement physically, mentally, and emotionally. I like to do dancing. Zumba's great, but you could walk, run, swim, bike. Yoga can also be very helpful. That was shown in a 12-week study. All right, so I want to take you over to my kitchen. We are in our kitchen, but I'll go to the other side and make something up called Beeler's broth. So Henry Beeler was a physician who wrote a book called Food is Your Best Medicine. This was in 1965. And he said, improper foods can cause disease and proper foods cure disease. Nothing else needs to be said. That's quotation marks from him. He came up with something, it's just packed so full of vitamins. And to me, it tastes so good. A few people I've given it to don't like it, but you've got so many nutrients in it that can help with just your body overall to alkalize, but to also help minimize, give you more fiber, give you the vitamins and nutrients that you need, the magnesium, even the B6, to help decrease PMS signs and symptoms. So here we're going to my kitchen, okay? All right, there. So in the Beeler's broth, oh yes, let me just show you the flaxseed. Make sure for this you're doing organic, so you're not getting xenoestrogens or toxins. So flaxseed, this is organic. The flaxseed, I recommend you buy it on ground, store it in the refrigerator or freezer, just so it doesn't become rancid in case it sits on the shelf too long, although recent studies show 10 months on the shelf might be okay. It depends how hot it is. I would keep it in the refrigerator or freezer. I'd use a tablespoon or teaspoon a day of ground, and you can just use like your, for example, a coffee grinder to grind it up, okay? And I did that this morning. And if you have extra, just put that in the freezer. Okay. Now, these are organic and I've washed them off with water. If for some reason you don't have organic and you can't buy organic, make sure that you do peel the vegetables like the zucchini. And you can also wash them with vinegar. Vinegar can get off, according to one of my nutrition teachers or environmental med teachers, Dr. Walter Crinian, it will get rid of like 80 to 90% of your toxin. Okay, look at these beautiful green veggies. Okay, we've got celery, green beans. I have cilantro. You don't have to put cilantro on it if you hate cilantro. It tastes like soap. Parsley and zucchini. All right. So what do we do? So you take a pan, okay? And you're going to get 2 cups of filtered water. We're going to have about a cup And you can double the recipe of cooked beans. I mean, of not cooked beans, of organic cut up beans, green beans, 2 zucchini. Now you can peel them or not peel them. Definitely peel them if they're not organic, but again, organic's best. And then 3 stalks of celery cut up. Okay, so we put it on the stove, cover it. Very important, you can put it up on high to medium high. Very important to only steam or boil. I boil it, but only about 3 minutes. I check it and it turns bright green. You just take a fork and see, make sure it's not mushy. You don't want to get it mushy. You're going to hurt the nutrients, but you don't want it hard. So just bright green, 3-4 minutes. It says 8 minutes in the recipe, but I think 3-4 minutes is good. So once it's all cooked, I cooked this earlier. Once it's all cooked, it is bright green. What I'm going to do is I'm going to make sure I don't burn myself. I did the first time I made this, that's why I say this. I put this in my blender along with the water, and you can add a little bit more water for your consistency. As you know, I did not add the parsley or cilantro yet. You don't want to cook those. So I add the cooked veggies along with the water. I add our beautiful mix of cilantro and parsley. Cilantro is so detoxifying. I add that all in and I blend that all up until it's pureed. And here we go. So here, can you see? All right. So here is our green, beautiful product. You can keep it in the fridge. Eat it. Eat it either warm, not really cold, and then you can have some every day. You could have, you know, an entire day where this is what you eat, a couple times a week. That is good. Okay, and that should help. I will put up information about if you do want to make an appointment at the University of Bridgeport Naturopathic Clinic. And we also have low-cost gynecological exams along with naturopathic care for all conditions. And thank you for joining. All righty, let me share our information here. Okay, here we go. There's the Beeler's broth recipe, how to make it, and then where you call for an appointment. Thank you for joining. All right.